pap smears hurt for some women. They shouldn't, but for some women, regardless, they're going to. And I want to talk a little bit about why. My name's Jay Vintage. I'm a board-certified family medicine physician in Oklahoma City, and we do trauma-informed consent when we're dealing with pap smears. So before we get into it, let's talk about what a pap smear is. It is a cervical cancer screening. It is not the same thing as a pelvic exam. We're generally doing a pelvic exam while we're doing the pap smear, and we teach women exactly what we're going to do before we do it. So let's talk about it. This right here, this is reproductive tract. This is what's inside of people with a womb. You see this tube-like structure at the bottom? That's actually the vagina. This whole thing up here, this is all uterus. Uterus, the opening to the uterus right here is a cervix, and you'll see if you look down the vaginal canal, it looks like a little half of a donut. Now, in real life, it looks like a regular donut, like this. And we went on a pap smear, we're taking cells off of that donut. So we're gonna lay this down just like so, okay? And so this is a woman laying down, and I wanna show you what we'll do during a pap smear. First thing, we'll use something like this. This is called a Texas swab. This is really to be very, very gentle and to clean any kind of like blood or any kind of cervical mucus out of the way so we can get a clean sample. So we use a speculum, and then we can see our little donut, and I will just go right in there and I'll just gently clean and make sure that we get all the blood and any of the mucus out of the way. Now, there are two ways that people are gonna collect a pap smear, okay? The first one, this is the one that we use. This is actually called, it's a little broom, and it's a little soft brush, and what it does is it just kind of goes kind of slightly into the center, and it should lightly touch, twist all the way around, pull out, and that's it. Now, it's looking more like this. You go in, hit the center, you twist around, and then you pull it out. There's a lot of people that I have seen that do the pap smears, and they like not just do this gently, but they like push and grind, and then it causes cramping and causes women a lot of pain. That shouldn't be happening because we get excellent samples every time. And then there's another way that you do a pap smear, because what this broom does is it deals with getting the sort of inside of the cervical orifice and the outside as well. That's why it's shaped like this. But in a traditional sense, the way that I learned in medical school is you use actually a spatula type thing. You go around the outside of the cervix, the outside of the donut, and you put that in this solution. And then this is a endocervical brush, and so you go inside of the cervix, twist, pull out, and that's done. So we're not taking any chunks out. We're not going inside all the way into the uterus. Shouldn't cause a whole lot of pain, but you should talk to your doctor about what's happening to your body before it happens. That way that you go in confident, informed, and make sure that any kind of anxieties are quelled before you go into it.